10 symptoms of menorrhagia you should know about. The symptoms of menorrhagia consist of an intense and prolonged increase in vaginal bleeding which extends beyond the normal menstrual cycle. There is a great variety of causes that can lead to menorrhagia, including abnormalities in the uterus, irregularities in the pelvis, problems with liver, kidney or thyroid health, hormonal imbalances, especially in relation to estrogen and progesterone, fibroids in the uterus, ectopic pregnancy, outside the uterus, the use of anticoagulant medication. Although abundant menstrual bleeding can happen regularly in a woman's life, there are several symptoms that can help to identify it as menorrhagia. If you want to know what they are, we suggest you continue reading this article. Menorrhagia. The best way of determining whether you suffer from menorrhagia is to pay attention to your bleeding. When there is enough blood to fill a sanitary towel or tampon every hour or two, even during the night, this is considered a serious enough blood loss to be defined as menorrhagia. This bleeding tends to last between 7 and 10 days. Complications in pregnancy. A pregnant woman should not have periods if she is completely healthy, because this increases the risk of miscarriage considerably. If you are pregnant and your menstruation starts, it is very important to consult your obstetrician so they can assess your symptoms and check on the health of your baby. Stress and menorrhagia. Stress is a direct symptom, because a woman's hormonal levels vary noticeably when she is suffering from menorrhagia, thus causing anxiety and worry. Anemia. Some of the most common symptoms resulting from excessive blood loss due to the prolonged periods caused by menorrhagia include anemia, pale skin, especially on the palms and soles of the feet, fatigue, shortness of breath, dizziness, generally feeling unwell. Fibroids. Fibroids are abnormal but non-cancerous tumors that appear in the wall of the uterus. They can enlarge considerably, so it is important to treat them as soon as they are diagnosed. Fibroids are usually associated with menorrhagia and can cause long and painful menstrual cycles. Infections in the uterus. Prolonged menstruation and excessive bleeding can cause infections in the uterus, the ovaries, the fallopian tubes. These infections should be treated with specific antibiotics. Pain. For women who experience menorrhagia, as well as intense pelvic pain, it is normal to suffer from fever, shivers, vaginal secretions, cramps. However, these symptoms of menorrhagia can be treated with anti-inflammatory remedies. Acne. Because menorrhagia can be a symptom of a hormonal imbalance, it is normal for women who suffer from it to also present related symptoms like polycystic ovary syndrome, POS, hirsutism, acne, Asian menorrhagia. Age is a significant factor in this condition, because menorrhagia is more common among young women in their adolescence who have just started their menstrual processes, middle-aged women between 30 and 50, postmenopausal women. Although menorrhagia is more common at these ages, it is important to consult a doctor to assess the health of your body if you notice signs at any age. Pain and bleeding during sexual intercourse. Pain and bleeding during and after sexual intercourse is very common for women who suffer from menorrhagia. It can also cause pain in the vulva, cramp, sensation of pressure in the lower abdomen, vaginal secretions, inability to carry out daily activities. Women who suffer from menorrhagia are significantly affected when it comes to carrying out their daily activities, because this condition prevents them from moving easily, lifting weights, feeling energetic. How can I know if I have menorrhagia? If the above-mentioned symptoms don't help you to identify whether you suffer from menorrhagia, we suggest keeping a record of menstrual periods and their duration, counting the number of tampons or sanitary towels used during each cycle, avoiding medication that contains acetylsalicylic acid, aspirin, because this can increase bleeding. It's also advisable for you to take this information to your gynecology appointments. This way, you can not only monitor your menstruation, but also determine whether you suffer from menorrhagia.